Good morning friends, I am Dr. Somil Kansal. I am Chief Neurosurgeon in Apex Hospital, Amritsar. So today I am going to discuss about headache, when to consider it serious and when to consult your doctor immediately. Any headache which starts suddenly or very rapidly worsens, then you should immediately consult your doctor. Or headache which you have never experienced before in your life, the headache which you are experiencing first time in your life can be serious headache. Can be because of brain hemorrhage, or it can be because of some tumor which has bled inside. So any hemorrhage which you are experiencing first time in your life can be serious. This is something very important. Second is, if headache is associated with vomiting, nausea, or some kind of deficits like visual deficits, blackout, then it could be a serious headache, and it is usually associated with some kind of fever, tumor, or brain hemorrhage. Secondly, a headache, progressive headache, worsening over weeks or days, and associated with some neurological deficit, visual, you have gradually diminishing vision, or you have diplopia, or you have some sectoral deficits in your vision, then it could be some tumor compressing your optic or visual pathway. Similarly, a headache which is associated with some other neurological deficit, like you have weakness on one of your sides, you have facial deviation, or you have hearing deficit, then it can also be because of some intracranial or brain pathology which is compressing some important areas of your brain, and it is an important cause where you should immediately consult your doctor. Headache in which you have unconsciousness, you lose your consciousness, or you have blackouts, then also it could be because of some brain pathology. Headache associated with seizures, especially seizures which starts after the age of 30 to 40 years, then it could be because of some brain disease which immediately warrants your doctor consultation. Headache which is sudden and which is with neck stiffness with vomiting can be because of sudden subarachnoid hemorrhage. Sometimes we have fever, and if the headache is associated with fever and with vomiting, that could be because of brain infection. Nowadays brain infection is becoming very common, which is known as meningoencephalitis. There are so many causes of meningoencephalitis. I will make another video for that in detail. Timing of headache is also very important. A headache which starts early in the morning, maybe around 4 or 5, which awakens you from headache, and associated with vomiting and sometimes feeling of dizziness or blackout, can be in some cases associated with some brain pathology, and you should immediately contact your doctor. These are the few of the causes, few of the symptoms of headache in which you should immediately consult your neuro doctor or general physician, which will get another further testing done.